Assalamu alaikum wa rahmatullahi wa barakatuh. Today, inshallah, we'll speak about facial bones fractures. Patient 80 old age admitted to emergency room complaining of the facial bones fracture. Road traffic accident, sending for CT scan with bone windows to see any bones fractures. This is coronal bone window. We started from the posterior to anterior. This is joints of the mandible, right and left. This appear left and right sphenoid sinus within sphenoid bone. This is sphenoid bone is within involved sinuses. You see anatomically greater wing and lesser wing of the bones. This area this bone contains the most important structures in the brain, many foramens, superior orbital fissures, optic canal, right and left, foramen ovale, foramen rotundum, foramen spinosum. You see also body of the sphenoid bone appear trachoid, right lateral trachoid bones, right medial trachoid bones, also left, right and left or medial and lateral trachoid plate. This area of the masseter muscles, temporalis, medial lateral trachoid muscles, temporalis and masseter's muscle. This orbit, you see right and left orbit. These muscles of the orbit muscles, eyes, right and left eye. You see there is bilateral floor fractures, floor orbital fractures more in the left side floor. You see herniations, bony defect leading to herniation contents of the orbit, left orbit in the left maxillary sinus. Okay. As well as also loculated gas demonstrated with the both orbits. Loculated gas is scattered throughout the orbits, as well as bilateral preorbital subcutaneous edema, more in the right side. You see more in the right side. This is subcutaneous edema, preorbital biliate, and loculated gas scattered throughout the both orbits. Also segmental fracture. This coronal, this axial bone window, this right and left sinuses, sigmoidal, sphenoid and maxillary sinuses. Comminuted minimal displaced fracture of the right zygomatic arch. This is right zygomatic arch, minimal displaced. This suturing and this arch, this is fractures. Also depressed fracture of anterior medial lateral walls of both maxillary sinuses. This maxillary anterior lateral medial, anterior lateral medial, and loculated gas and filled with the hemorrhage, hematoma, air fluid levels, and filled with the hematoma and hemorrhage. Also sphenoid or isthmoid air sinuses filled with the hematoma and slightly right deviated nasal septal here. Also, you can see minimally displaced fracture of the right lateral tracheoid blade fractures here. Okay, fluid leakage with the frontal and maxillary sinuses and all filled with the hematoma. No fracture in the mandible or basal skull fractures. And this is case of the, also you can see in the sagittal bone, you can see minimally displaced segmental fracture of the nasal bone. You see this nasal bone. This type of classification of the fractured facial bones is Lee 42. Thank you for following me, Muhammad Ezzalarab.